The new topic for today is inflammation. This topic is very important and usually they ask types of inflammation, stages of inflammation. So most of the time it is asked for 5 marks. So first of all, what is inflammation? When do you get inflammation? Whenever there is any tissue injury, what happens is there will be local response. That is usually there is release of some chemical mediators. So that in turn is going to result in inflammation. Inflammation in simple terms is referred as swelling. So remember, whenever there is any tissue injury, there will be a complex local response where there is release of certain chemical mediators that is referred as inflammation. There is one more definition. It is a complex reaction of the tissue and its microcirculation to pathogenic insult. But the most easiest definition is whenever there is any tissue injury, there will be a complex local response that is referred as inflammation. Next is moving on to types. Now, according to the types of inflammation, we have got acute inflammation and chronic inflammation. So, as the term indicates, I might have already discussed regarding what is acute condition, what is chronic condition and all. So, similarly, what is acute inflammation? Acute means it is rapid in onset. That is, it may start suddenly but it is present for a very short duration of time. Okay, so short duration of time means here acute inflammation will last for minutes or for hours. After that, what happens is healing will happen, that is repair will happen, and the predominant cells which is involved in acute inflammation is neutrophils. Okay, I'll repeat it. Acute inflammation means it is rapid in onset, it starts suddenly but it is present for a very short duration of time, that is only for minutes or hours. After that, healing will occur or repair will occur, and the predominant cells seen in acute inflammation is neutrophils. Next is chronic inflammation. Chronic is just the opposite of acute. Chronic inflammation is present for a longer duration of time and it is present for weeks or months together. And what happens is sometimes what will happen after chronic inflammation, it may also have again continuous signs and symptoms because it is present for a longer duration of time. And here the predominant cells involved are macrophages and lymphocytes. Sometimes what happens is because of so much symptoms or so much of inflammation, it will result in fibrosis, that is scar tissue formation will be there or fibrous connective tissue will be formed. So that happens only in chronic inflammation. So acute inflammation is rapid in onset, it is short duration. After that, repair happens. Predominant cells is neutrophils. Chronic inflammation means it is present for long duration. Predominant cells are macrophages and lymphocytes, and sometimes it may result in scar tissue formation or fibrosis. Usually after the healing, it may result in scar tissue formation or fibrosis. Next is agents which result in inflammation, or these can be referred as causes also. Okay, they are agents which cause inflammation. Now what will result in inflammation or swelling? You all, if you are just thinking in your mind, you will only think about certain accidents or certain injuries. Other than accidents or injuries, there are so many other causes which can result in inflammation. Okay, so first of all, it can be because of physical agent. Physical agent example includes very hot, if you touch hot objects or if you touch very cold objects or even your burns. Okay, that will result in inflammation. So immediately after this injury, what happens? There is swelling. Okay. Other than physical agents, we have also got mechanical agents. Mechanical agents will are almost similar to physical agents, but here mechanical agents will include your accident, your trauma or your injury. Next cause of inflammation is chemicals. Certain chemical agents like toxins or drugs or venom from snakes or acids, alkalis, all these are chemicals. So that also will result in inflammation. Next cause of inflammation is infection. Now, infection also can cause inflammation. For example, your bacteria, virus, fungi, protozoa, all this will result in sometimes what? Inflammation. Because of they may result in inflammatory response. If they are affecting respiratory system also, it may result in inflammatory response. Okay. So next cause of inflammation is ischemia. This term is important. Ischemia comes again and again. Ischemia means reduced blood flow. Whenever there is prolonged reduced blood flow, it eventually will result in death of the tissue. The death of the tissue is referred as necrosis. Again, I'll repeat. In ischemia can also result in inflammation, and ischemia means decreased blood flow. Continuous decrease in blood flow will cause the death of any tissue. The death of the tissue is referred as necrosis or gangrene. Next cause of inflammation is autoimmune conditions. So autoimmune conditions mostly there is self-destruction of one's own immunity. So that also can result in inflammation. Other than that, allergens can also cause inflammation. Next, we have already seen the causes of inflammation. Next, we will see the signs and symptoms of inflammation. So, the clinical manifestation, we call them as clinical manifestations. Okay, clinical manifestation means signs and symptoms. So what will be the symptoms of inflammation? What will happen whenever there is swelling in your body? You just think about trauma or injury. You might have undergone any accidents. And what happens immediately when you undergo any injury or trauma is, first of all, there will be bleeding. That is for sure. Along with that, there is redness. Redness is referred as erythema. It is also called as rubor. Redness is also called rubor or erythema, and why it happens is why redness will be seen in the place of injury because of vasodilation or increase in blood flow. Next symptom of inflammation is when you touch the wound, usually it is warm to touch. Why? Somewhat heat will be there. Okay, that is called as scalor. Okay, warmth is also called as scalor. Why warmth is seen in the wound region? Because of increased blood flow. Okay, so because of increased blood flow, the wound will be somewhat warm to touch. When you are touching, it will be warm. Next is patient will experience pain. So immediately when you have got any injury, any fracture or whatever, you will experience lot of pain, isn't it? That pain is referred as dolor. Why pain is there? Because of release of chemical mediators. There is lot of release of chemical mediators whenever there is injury. We'll see about this chemical mediators later. Other than that, along with pain, there is swelling or edema. Why swelling or edema happens? It is because of fluid retention. There will be shift of the fluids. Okay, so fluid retention is going to result in swelling or edema. Next one is loss of function. Here loss of function means person's ability to move or patient's ability to perform activities will be reduced. That is referred as loss of function. Why loss of function happens? Why the person is not able to move the extremities or body part? Maybe because of pain or swelling. Suppose you have got a fracture, you will have redness or erythema or rubor. You will also have warmth, you will have pain, you will have swelling. Along with that, you may not be able to walk or lift heavy objects and all, mainly because of swelling or pain. Then next is there can be purulent exudates. Purulent exudates means pus. Why pus forms? It is because of infection. It is not normal. Pus is formed because of any infection. So this is about the clinical manifestations of inflammation. Next is moving on to process of inflammation. This is only the process of inflammation. Certain terminology is there here. We will see the stages of inflammation after this. There are so many series of events that happens in inflammation. Okay, now what are the series of events which happens in inflammation? First is vasodilation, vascular permeability, exudation, and then vascular stasis. So these are the four main processes or series of events that happens in inflammation. First of all, we have got vasodilation, vascular permeability, exudation, and fourth one is vascular stasis. We'll see what is each one of it. What do you mean by vasodilation? Remember the term here, vasodilation. Dilation means it is dilating. Okay. What will happen when there is dilation of blood vessels? There will be increase in the blood flow. Remember, whenever there is a pipe, if the size of the pipe increases, what will happen? More and more water will go, isn't it? Similarly, here also, whenever there is dilation of blood vessels, increased blood flow will be flowing to the area of inflammation. So what happens when there is increased blood flow? Already I told in the previous slide. Whenever there is more and more blood flow, it will result in redness, and it is also going to result in warmth or heat. Second series of event that happens in inflammation is vascular permeability. Now, vascular permeability is mainly because of release of chemical mediators. I told there will be release of lot of chemical mediators. It could be your prostaglandin, histamine. So many chemical mediators are released immediately whenever there is any injury. So that will result in endothelial cells will become leaky. Okay, so endothelial cells will become leaky. That is called as vascular permeability. Next one is exudation. The next series of event that happens in inflammation is exudation. Exudation means there is formation of exudates, means fluids will be there, along with that proteins, red blood cells, white blood cells, all this will be escaping from the intravascular space, and more exudates will be collecting. So that is why there is fluid retention and there is swelling. Okay, so because of this exudates, that is collection of fluids, proteins and other things, there is swelling or edema in the region of injury. The next series of event that happens is vascular stasis. Stasis means actually collecting. Okay, stasis means collecting. Here, vascular stasis means the blood will become slow. Okay, flow of blood will become slowly. And what happens is, why it is becoming slow? Along because of this vasodilation and because of fluid exudation, it will, and there will be release of chemical mediators. Because of all that, there will be collection of fluid, okay, because of the inflammation. That is referred as vascular stasis. Slowing of blood in the bloodstream along with vasodilation and exudate formation and chemical mediators, that will result in collection of excess of fluid, that is called vascular stasis. So the process of inflammation is, first one is vasodilation, means increased blood flow. Second is vascular permeability, which means release of chemical mediators which will cause cells to become leaky. Then exudates will form, that is excess of fluids, proteins will start to accumulate. And last one is vascular stasis. Because of all this exudation, vasodilation, there will be stasis of the blood. Next is the most important part, stages of inflammatory reaction. So the stages of inflammation or stages of inflammatory reaction is divided into three main stages. First one is tissue injury, next is release of chemicals, then is leukocyte migration. Now when this comes for the exam, you have to explain all these three. Along with that, you will also have to explain about healing. Okay, how healing happens, in which stages healing happens, that has to be explained. So the first stage of inflammatory reaction is tissue injury. So what happens? First, whenever there is any trauma or injury, immediately what will happen? There is tissue injury. There will be bleeding and there will be tissue injury. That is the first stage. That is very easy. Okay. So the first stage is tissue injury. Tissue injury means whenever there is any trauma or whenever there is any accident, most of the time what will happen, there is bleeding and then that will result in tissue injury. After tissue injury, the second stage is release of chemicals. So immediately whenever there is any injury to the tissues, there will be release of certain chemical mediators. Which are the chemical mediators? Example are histamine, prostaglandin, lymphokines, bradykinin, serotonin, so many other chemical mediators are there. I have written only few examples here. So, whenever there is injury, there is release of certain chemical mediators like serotonin, histamine and prostaglandin, and this chemical mediators will activate your inflammation. Okay, chemical mediators will activate inflammation, and because of that there is vasodilation and permeability of capillaries. Already I have explained this term permeability, means the cells will become leaky, and vasodilation and increased permeability will result in increased blood flow to the body part. So this is particularly happening whenever there is release of chemicals. So whenever, first stage I'll start, first one is tissue injury. Whenever there is any trauma or injury, there will be bleeding and there is tissue injury. Next is, once there is injury to the tissues, there is release of chemical mediators like serotonin, histamine, prostaglandin, and then because of this chemical mediators, it will activate your inflammation, because of which vasodilation happens and there is permeability of capillaries, that the cells will become leaky. Because of that, more and more blood flow will be there to the injured part. Next, just note down this. These substances means these chemical mediators will act as chemical messengers which will attract the body's natural defense, that is referred as chemotaxis. Okay, chemotaxis means chemical mediators will attract natural defense mechanism, that is called as chemotaxis. Okay, so next what happens is the blood flow, I have already told in the previous slide, increased blood flow has happened to the injured body part. Okay, so because of the increased blood flow, what will happen? There will be redness, there is erythema and redness means one and the same. It is warm to touch, patient will be having pain also. So along with that, what happens is these are the symptoms which are happening because of the increased blood flow. Okay. So along with that, increased permeability will be there. Because of that, cells will become leaky. Okay. And then what happens is the spaces and lymphatics will be blocked by fibrinogen clots. That in turn results in edema. Okay. Already I have told why edema or swelling happens. Edema or swelling is mainly because of increased permeability or because of leaky cell. Okay, so that is resulting in edema. So again we will see in stage 2 what happens. In stage 2, whenever there is injury, there is release of chemical mediators like histamine, prostaglandin, bradykinin, and these chemical mediators will activate inflammatory response, and that will cause vasodilation and it will increase the permeability of capillaries. Because of that, more and more blood flow happens, and because of more blood flow, the patient will experience redness, warmth and erythema, and this increased permeability or leaky cells will block the lymphatics and will result in more and more fluid retention. So there is edema. Next is stage 3, leukocyte migration. Here what happens is in leukocyte migration, mostly this chemotaxis will result in migration of WBC or leukocytes to the damaged area, because all this has to be repaired. The injured body part has to be repaired, no? So this chemotaxis happens. Already I have told what is chemotaxis. Chemotaxis means what? This chemical mediators will attract natural defense mechanism of the body. Okay, chemical mediators will attract natural defense mechanism of the body, that is called chemotaxis. So that results in migration of leukocytes or WBC to the injured body part. So this damaged tissue will be infiltrated by this WBC or leukocyte. What is the function of leukocyte or WBC? They will engulf the bacteria or they will engulf the necrotized area, the region or the body part which receives decreased blood flow and which is dead, that will be engulfed by the leukocyte. That is the function of this leukocytes or WBCs. Then along with that, two types of leukocytes will be seen, that is macrophages and neutrophils. Macrophages and neutrophils also help in the healing process. Okay. So leukocyte migration means this chemical mediators will act along with they will act like a natural body's mechanism, and they'll start to migrate WBCs or leukocytes to the injured body part. These leukocytes or WBCs, they will engulf the bacteria, and the dead tissue or the necrotic tissue will be engulfed by WBCs. Along with that, there is also macrophages and neutrophils. Now, we'll see what is the function of macrophages and neutrophils. Neutrophils will neutralize the harmful bacteria and thus help in healing. Neutrophils will neutralize the harmful bacteria and will help in healing of the wound. Similarly, macrophages also help in healing by engulfing the bacteria, and the dead cells or the necrotic area will be engulfed by this macrophages. So what will happen? New cells will grow fast. Okay, and you should remember that all this process of neutrophils, macrophages and all will occur within 72 hours of injury. Okay, and finally what happens is it will promote tissue healing, and then it will result in final stage, that is scar tissue formation or fibrous tissue formation. So this is particularly about the stages of inflammation. It is very easy, you have to remember only the main things. The first stage is tissue injury. Whenever there is any trauma, there will be bleeding and there is tissue injury. Next is release of chemicals. Whenever there is injury to the tissue, there will be release of chemical mediators like histamine, prostaglandins, and that will activate inflammation, that will cause vasodilation, it will increase the permeability, and that will increase the blood flow. Because of what? Symptoms like erythema, redness and warmth will be seen. Increased permeability and leaky cells will cause edema or fluid retention. Then third stage is leukocyte migration. This chemical mediators will act as a body's natural mechanism and will result in release of your WBCs or leukocytes to the damaged area. The leukocytes will engulf the harmful bacteria and the dead tissue or necrotic tissue. And along with that, there is also release of macrophages and neutrophils. Neutrophils will neutralize harmful bacteria, and macrophages will also engulf bacteria and dead cells. All this process occurs within 72 hours of injury and may remain for weeks because healing has to happen. And finally, there is scar tissue or fibrous tissue formation. Next is regarding tissue healing. How healing of the tissue will happen? It happens by collagenation, and it also happens by angiogenesis. Then proliferation happens, and then remodeling occurs. So these are the process of tissue healing. First one is collagenation, next one is angiogenesis, then proliferation, and then last one is remodeling. So first one we will see what is collagenation. So wound healing happens at the end of the inflammatory process. It is mainly done by macrophages and fibroblasts. Already I told you what is the function of macrophage and fibroblast. Macrophages will work tirelessly. They will clear the damaged area. They will also clear this damaged whichever this bacteria is there, that also they will be usually trying to clean. Okay, and what happens is when they clear this damaged area, new cells will be formed, that is regeneration will happen. So that is done by macrophages. Next, fibroblast is also responsible for collagen producing cells because they will result in new tissue cells. That is why it is referred as collagen producing cells. Okay, so this entire process is referred as collagenation because fibroblast result in collagen producing. Okay, so tissue healing happens first of all because of collagenation, mainly by macrophages as well as fibroblast. Macrophages will work tirelessly to remove the dead bacteria. It will clear the damaged area and helps in regeneration of new cells, while fibroblast will result in collagen producing. That also will help in producing new tissues. Next is angiogenesis. As the term indicates, angiogenesis means new capillaries are formed. Okay, angiogenesis is sometimes referred as revascularization. Okay, means new capillaries or new blood vessels will start to grow in that particular region. That is called as angiogenesis. New capillaries will form, that is called angiogenesis or revascularization. Next, proliferation happens. Now, proliferation will last for usually 4 weeks. And when the injury is very severe, what happens is the affected area has tissue cells and granulation, that is scar tissue will be there. Okay. So, if granulation tissue is not removed, it later results in scar formation. So you know that what will happen when there is more excess of scar formation, it will decrease the functional ability of the tissue. So that happens in proliferation. Proliferation can last up to 4 weeks. If injury is very severe, the affected area will be having granulation tissue. And if this granulation tissue is not removed, finally it results in scar tissue formation. Next is remodeling. Remodeling means new cells will form and that will be functioning, they will work like a functioning tissue. That is referred as remodeling. Now, remodeling process can take months or years together. It depends upon how much big trauma or injury a person has had. So, big injury is there means remodeling will take so many years, especially of fracture and all. Small wounds means remodeling happens very, very fast. So, that is particularly about how your wound is tissue is healing. Okay, first one is because of collagenation, mainly macrophages will engulf your bacteria, then damaged area will be cleared and regeneration will start. Fibroblasts help in collagen producing. Angiogenesis will happen, that is new capillaries will form. Proliferation occurs, that is the injured area will undergo granulation tissue. If granulation tissue is not removed, it will result in scar formation. Last is remodeling, that is new cells will become functional, okay, which already it has resulted in angiogenesis and proliferation, isn't it? So new cells will become functional, that is called remodeling. Next is regarding treatment of inflammation. Now, how will you treat a person who is already having swelling or inflammation? So just imagine if you have got a big wound or if you have got a fracture, how are you going to treat? You can treat the symptoms. First of all, you have to find out what symptoms are usually present in the patient. You can give NSAIDs. Now this term is new for you. NSAID means non-steroidal anti-inflammatory drug. Okay, you can study again in pharmacology. I'll repeat. Non-steroidal anti-inflammatory drug. These NSAIDs will reduce the pain. Okay, and how it reduces the pain is it inhibits chemical mediators. The example of NSAIDs are aspirin and ibuprofen. These are the name of the drugs. Then patient is having swelling or inflammation. To reduce that, you will give corticosteroids. We have got lot of corticosteroids. We can give prednisone. Then we have got hydrocortisone, betamethasone. Okay. So these are the examples of corticosteroids. Next, patient can have lot of itching or they can have allergic response. So to avoid that, you can give cetirizine. Then to reduce the pain, you can start with some nursing management like cold application and hot application can be done. This will reduce the pain and usually it reduces the inflammation. You can use any hot applications also or cold applications also. Okay. So this is the process of treating inflammation. So remember, this topic is very important. You can go through this audio again and again so that you will be thorough regarding the stages.